sorry that we don't have many other people, but at least it's good, it's intimate, so you learn as much as possible here. So, I don't know, have you heard of our company, Institute Hyalual? I know pretty you have, yes. So, this is a company based in Switzerland. They specialize in post-processed care and injectables. And they focus on, they put a lot of effort and money into coming up with products that are unique and specially formulated to really regenerate the skin and rejuvenate the skin, because that's their primary focus. They're coming up with unique ingredients that you're not going to find in any other products, and to really be effective and give you optimal results. So what's redermalization? Redermalization is a technique which was coined by the company. Okay? It improves texture and quality of the skin, hydrates, rejuvenates, lightens and tightens the skin, prevents wrinkle appearance and reduces existing wrinkle depth, eliminates stretch marks and scars, and produces a long-lasting effect. Redermalization consists of two things, the technique and the product. Okay? The product is completely unique because it has two unique ingredients, hyaluronic acid and succinic acid. Now you won't find succinic acid in any other products. It comes in 3 different concentrations, and later on we will go into a little bit more detail about why we use 3 different concentrations. They all have the same amount of succinic acid, but different amounts of hyaluronic acid, and that's the key thing. Now, what is succinic acid? I'm sure that you've all heard of it, or if not, then you've definitely heard of course, respiratory process. You've probably heard of mitochondria, so you know that obviously the cells need energy comes from respiration, and respiration involves a series of compounds, and one of them is succinic acid, the end product. And it's really important, it's one of the key things that gives energy to the cells. So really, the idea is that by giving the cells this product, you're improving the energy levels of the cells, so you're increasing the turnover. If you increase the turnover, what does that mean? That you're increasing the collagen synthesis. So obviously we know that fibroblasts in the dermal layer of the cell, of the skin, they make collagen and elastin, and those are the 2 key things to anti-aging. So if you're, essentially what you're doing, you're giving the skin that trigger that it needs to help it to form more collagen and elastin. And not only that, but succinic acid also, it's been shown that it triggers the release of nitric oxide. Nitric oxide, it dilates the blood vessels. So by dilating the blood vessels, what you're doing, you're actually increasing the blood supply to the skin. So of course, the skin gets more blood supply, you're helping it regenerate. And another thing is that it has antioxidant action. Now, of course, if you're increasing the energy process of the cell, you're mopping up all the excess oxygen that the cell doesn't use, and because excess oxygen leads to free radicals, so essentially it has an antioxidant action. And the other thing is that the alpha-ferrosuccinate, so which is a derivative of the succinate, it's been shown to actually have anti-tumor properties in mouse models, and that's increased interest in its property of actually having anti-tumor properties. Now, we've done some in vitro studies. In vitro studies essentially means working on the cells. And what we see here is that if we have cells that are just with vitamin, normal vitamin levels, and if you just add succinic acid to the cells, you essentially see very similar results. So that's good. That means that succinic acid alone is behaving very similar to the vitamins that a cell, all the essential vitamins that a cell needs. But then, when you combine the succinic acid and the hyaluronic acid, you suddenly see this increase in fibroblasts, this effect on the fibroblast turnover. The increase in stimulation, they're proliferating more, and the good thing is that if you increase that concentration, you're actually seeing a bigger effect. Now, it's not just on fibroblast activity, but actually on collagen synthesis. Remember we said that if you give the cells more succinic acid, you're actually giving it that trigger it needs to build more collagen. We can actually prove this because what we did is we used a thing called a dermalab. It's like a ultrasound machine. It comes with a probe. You put it on the skin, and what it does is sends waves into your skin, and they bounce off any protein inside the dermal layer. And the main protein, of course, we know is collagen. So the machine gives us a score. So first of all, it gives you this sort of the gold color, and that represents the collagen in the dermal layer. And then based on that, it gives you a score. So if you imagine, here, we've actually used the dermalization technique, which we will show you later, along with the product. And what we've done is measured the collagen levels and the thickness of the skin. So you can see, after 2 weeks of treatment, the collagen level went up and the skin became thicker. And this is just a, just a basic picture of, what happens when you, before the treatment, you can see the hands, these vessels, they're a bit more superficial, and we have a lot more photos, and Dr. Victor will show you more photos, but this is just a basic one. And just to show you that this technique is not necessarily just for the face, you can use it all over the body, and again, we'll talk more about that. But you can see that, what we said, there's more collagen, the skin is thicker, and hence all of these vessels, they disappear. So this is what, most patients like. Okay, so what happens after you give them the treatment? Now, obviously you need to, the whole ethos of the company is, don't just let your patient go home. Give them that aftercare as essential. That's something that's neglected by a lot of practices. And so this is what makes our company very unique, because we want to give the patient a full treatment, not just, do the injection and then let them go home. Because post-procedure care is important for patient's journey, not just psychologically, not just physically, but of course psychologically as well. Of course, there's side effects and complications that come out of the treatment that you're giving your patient. Infection is a big thing, pigmentation and fibrosis, these are all more long-term effects. And then, if you don't look after your patient properly after you've given the treatment, then it has an impact on the results of the treatment. And not only that, you have to think about the fact that your patient is you want that patient to come back to the clinic, so you want to make sure that that patient is happy. And that what sets your practice apart from somebody else who does not provide post-procedure care. Okay, so what happens after these treatments? So of course, inflammation is a big thing, because you're causing trauma to the skin, and it's caused by needle puncture or laser. So any procedure you do that you're causing some sort of trauma to the skin, you're going to have either laser treatment. I've heard, a lot of people who do either hair removal or just rejuvenation. They don't use anything because they just say, oh, the skin will get better. No. What you're doing with the laser, you're damaging the top layer of the skin, and there's major water loss at the laser. So you have to